Herpes simplex virus infections affect millions of people worldwide, yet they remain surrounded by confusion, stigma, and misinformation. Herpes simplex virus, commonly abbreviated as HSV, is a highly contagious virus that causes lifelong infections in humans. It belongs to a family of viruses called Herpesviridae, which includes other viruses like varicella-zoster, which causes chickenpox and shingles, and Epstein-Barr virus, responsible for mononucleosis. What makes HSV particularly interesting is its ability to stay in our bodies. After the initial infection, the virus travels to nerve cells near the spine, where it remains dormant until certain triggers reactivate it. This clever survival strategy means that while your immune system can suppress active infections, it cannot eliminate the virus completely from your body. When the virus becomes active, HSV causes characteristic painful blisters or sores at the site of infection, typically around the mouth or genitals. These sores fill with clear fluid containing millions of viral particles, making them highly contagious. After a period of time, the blisters break, leaving painful ulcers that eventually crust over and heal. Despite its reputation, herpes is incredibly common. According to the World Health Organization, over two-thirds of the world's population under age 50 carries HSV-1, and hundreds of millions more carry HSV-2. Many infected individuals never develop symptoms or don't recognize them, unknowingly transmitting the virus to others. While herpes isn't life-threatening for most people, it can cause significant physical discomfort, emotional distress, and social stigma. Types of HSV infections. There are two main types of herpes simplex virus, HSV-1 and HSV-2. Traditionally, HSV-1 was associated with oral infections, cold sores, or fever blisters, while HSV-2 was primarily linked to genital herpes. However, this distinction has blurred in recent years, as either type can infect either location. HSV-1 is tremendously common, with infection rates exceeding 67% globally in people under 50. It's usually acquired during childhood through non-sexual contact, like kisses from family members. HSV-2 affects about 11% of people worldwide aged 15 to 49 and is primarily transmitted through sexual contact. Herpes infections can also be classified by whether they're primary, first-time, or recurrent infections. Primary infections often cause more severe symptoms, including fever, swollen lymph nodes, and extensive sores, particularly if they occur in adulthood rather than childhood. Recurrent infections typically have milder symptoms and shorter duration than the primary infection. In immunocompromised individuals, such as those with HIV or AIDS, or those undergoing chemotherapy, herpes infections can be particularly severe, extensive, and persistent, sometimes spreading to internal organs. Causes and transmission of HSV infections. Herpes simplex virus is transmitted through direct contact with infected skin or mucous membranes, bodily fluids, or sores of an infected person. The virus enters the body through tiny breaks in the skin or through mucous membranes. What many people don't realize is that transmission can occur even when no visible symptoms are present, though the risk is highest during an active outbreak when sores are visible. This asymptomatic transmission makes herpes particularly difficult to control and contributes significantly to its widespread prevalence. For oral herpes, transmission commonly occurs through kissing, sharing eating utensils, lip balm, or towels with someone who has an active infection. Children often contract HSV-1 from relatives who kiss them while having a cold sore or even when the relative has no visible symptoms. Genital herpes is primarily spread through sexual contact, including vaginal, anal, and oral sex. The virus can be transmitted from genitals to mouth and vice versa, which is why we're seeing increasing cases of HSV-1 in genital infections and HSV-2 in oral infections. Autoinoculation is also possible, meaning someone with an oral infection can spread it to their genitals or other body parts through touching a sore and then touching another area of their body without washing hands in between. Certain factors increase the risk of contracting herpes or experiencing outbreaks if already infected. Weakened immune systems, whether from HIV or AIDS, chemotherapy, or other conditions, make individuals more susceptible to contracting the virus and experiencing more frequent and severe outbreaks. Women are more biologically susceptible to genital herpes infections than men due to larger areas of exposed mucous membrane. Stress, illness, fatigue, sun exposure, hormonal changes during menstruation, and friction or abrasion at the infection site can all trigger reactivation of the dormant virus in those already infected, leading to recurrent outbreaks. Symptoms of HSV infections. Many people with herpes simplex virus infections never develop symptoms or have such mild symptoms they don't notice them. For those who do experience symptoms, they generally appear in cycles with periods of active infection followed by dormancy. During the first, or primary, infection, symptoms are typically more severe and may include prodromal symptoms that occur before sores appear. These can include tingling, itching, or burning sensations at the site where blisters will eventually appear. Some people experience flu-like symptoms, including fever, body aches, swollen lymph nodes, and headaches, particularly during a primary infection. The most recognizable symptom of herpes is the characteristic sores that progress through several stages. Initially, the affected area becomes red and sensitive. Small fluid-filled blisters then form, which can be painful and tender to touch. After a few days, these blisters break open, creating shallow ulcers that ooze clear or slightly yellowish fluid containing infectious viral particles. These open sores eventually crust over and slowly heal without leaving scars in most cases. A complete outbreak cycle typically lasts 2 to 4 weeks for a primary infection and about 7 to 10 days for recurrent episodes. For oral herpes, sores typically appear around the lips, mouth, chin, cheeks, or inside the nostrils. Some people experience a condition called gingivostomatitis during a primary HSV-1 infection, which involves painful sores throughout the mouth and swollen, inflamed gums. Genital herpes affects the genitals, buttocks, and thighs. For women, sores can appear on the vagina, vulva, cervix, anus, and surrounding skin areas. Men typically develop sores on the penis, scrotum, buttocks, and sometimes inside the urethra, causing painful urination. Recurrent outbreaks of herpes tend to occur at or near the same location each time and are usually less severe than the initial outbreak. Most people experience the highest frequency of recurrences during the first year after infection, with outbreaks generally becoming less frequent over time as the immune system adapts to the virus. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of HSV infections. When a patient presents with characteristic symptoms like painful blisters or ulcers, the doctor will look for the telltale clustered blisters or ulcers and their location, which can provide strong clues to diagnosis. The pattern and appearance of lesions, along with the patient's report of symptoms like tingling or burning before the outbreak, often suggest HSV infection. However, visual diagnosis alone isn't always reliable, as other conditions can present with similar-looking sores, including syphilis, bacterial infections, allergic reactions, or even skin irritation. To confirm the diagnosis, various laboratory tests can be performed. The gold standard is the viral culture, where a sample is taken from a fresh blister by swabbing the base of a lesion and then cultured in a laboratory to see if HSV grows. While highly specific, cultures become less sensitive as lesions begin to heal, sometimes leading to false negatives. Polymerase chain reaction (PCR) tests detect the genetic material of the virus and are more sensitive than viral cultures, particularly for lesions that have begun to heal. These tests can also distinguish between HSV-1 and HSV-2, which can help guide counseling about recurrence rates and transmission risks. Blood tests that detect HSV antibodies can determine if someone has been infected with HSV, even without current symptoms. It's worth noting that many people with herpes remain undiagnosed because they either don't develop noticeable symptoms or mistake their symptoms for something else like ingrown hairs, pimples, or yeast infections. Treatment for HSV infections. While there's currently no cure for herpes that can completely eliminate the virus from the body, several effective treatments can manage symptoms, speed healing, and reduce the frequency of outbreaks. Here are the main treatment approaches. Number 1. Antiviral medications. These are the cornerstone of herpes treatment and work by preventing the virus from multiplying. Three main antiviral medications are FDA approved for treating herpes: acyclovir, valacyclovir, and famciclovir. These medications are most effective when started within 72 hours of symptom onset. For a first outbreak, which is typically more severe, higher doses are usually prescribed for 7 to 10 days. For recurrent outbreaks, a shorter 3 to 5 day course is often sufficient. Antivirals can be taken in 3 different ways, depending on individual needs. Episodic therapy involves taking medication only during outbreaks to shorten their duration and reduce symptoms. Suppressive therapy involves taking a lower dose of antiviral medication daily to prevent outbreaks, which can reduce recurrences by 70 to 80% and significantly decrease asymptomatic viral shedding, making it less likely to transmit the virus to partners. For severe cases or in immunocompromised patients, intravenous antivirals may be necessary, particularly if the infection has spread to the brain, which is called herpes encephalitis, or other organs. Number 2. Pain management. Since herpes outbreaks can be quite painful, various pain management strategies can provide relief. Over-the-counter pain relievers like acetaminophen or ibuprofen can help reduce pain and inflammation associated with herpes outbreaks. Topical anesthetics containing benzocaine or lidocaine can also temporarily numb the affected area and provide short-term relief from pain and itching. These are available as creams, ointments, or sprays and should be applied according to package directions. For genital herpes outbreaks, sitz baths, which involves sitting in a few inches of warm water, can soothe affected areas. Similarly, cool compresses can provide relief for oral or genital lesions, reducing pain and inflammation. Some patients find that gentle application of petroleum jelly or other protective ointments helps prevent cracking of healing sores and reduces pain from friction against clothing. Home remedies for HSV infections. While medical treatments are essential for managing HSV infections, many people find additional relief through home remedies. Here are some approaches that may help soothe your symptoms and support healing. Number 1. Warm or cool compresses. Applying either warm or cool compresses to the affected area can provide significant relief from pain and itching. Cool compresses work by reducing inflammation and numbing the area temporarily. You can make one by wrapping ice in a clean cloth or using a washcloth soaked in cold water. Apply for 10 to 15 minutes several times daily. Warm compresses, on the other hand, may promote circulation and healing. A clean washcloth soaked in warm, not hot water works well. Some people find alternating between warm and cool compresses provides the best relief. Number 2. Aloe vera gel. Aloe vera is known for its soothing and healing properties. When pure aloe vera gel is applied directly to herpes lesions, it can help reduce pain and speed healing. The natural anti-inflammatory compounds in aloe can reduce swelling, while its antiviral properties may help fight the active virus. For best results, use pure aloe vera gel from a fresh plant leaf or purchase a high-quality commercial product without alcohol or added fragrances, as these can irritate the sores. Gently apply a thin layer to the affected area several times daily after carefully washing your hands. Number 3. Lemon balm. This herb contains antiviral compounds that may help fight HSV. Studies suggest that topical applications of lemon balm extract can reduce the healing time of herpes lesions and decrease the frequency of recurrences. You can find lemon balm as a cream or ointment in many health food stores, or make a strong tea from dried leaves, allow it to cool, and apply with a clean cotton ball. Many users report reduced pain and faster healing when applied several times daily at the first sign of an outbreak. Number 4. Lysine supplements and diet adjustments. Some research suggests that lysine, which is an essential amino acid, may help prevent herpes outbreaks by inhibiting arginine, another amino acid that can activate the virus. While scientific evidence is mixed, many people report fewer outbreaks when taking lysine supplements, typically 1,000 to 3,000 milligrams daily, or increasing lysine-rich foods in their diet, such as fish, chicken, eggs, and legumes. At the same time, reducing arginine-rich foods like chocolate, nuts, and seeds during prodromal symptoms or outbreaks may be helpful for some individuals. Number 4. Stress reduction techniques. Since stress is a common trigger for herpes outbreaks, stress management can be an effective preventive strategy. Regular meditation, even just 10 to 15 minutes daily, has been shown to reduce stress hormones and boost immune function. Deep breathing exercises can also activate your parasympathetic nervous system and can quickly lower stress levels. At the end, living with herpes can be challenging, but with proper treatment and self-care, most people with HSV lead normal, healthy lives. Now we want to hear from you. Have you or someone you know ever dealt with herpes? What strategies have helped in managing outbreaks and symptoms? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.